Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Chest pain. Introduction. Having chest pain can be scary. It does not always mean that you are having a heart attack. There can be many other causes of chest pain, such as lung or digestive problems. Chest pain can be a sign of a serious problem. If you experience chest pain, you should always check with your healthcare provider. This program discusses chest pain and its common causes. It also covers the diagnosis and treatment of chest pain. The chest. The chest is the upper part of the torso, between the neck and abdomen. Many organs, bones, and muscles are found in the chest. This section reviews anatomy of the chest that you need to know to understand chest pain. One of the main organs in the chest is the heart. The heart is a highly specialized muscle. It is responsible for pumping blood to all the organs in the body. The heart is enclosed in a sac. This sac is called the pericardium. It helps the heart work properly. The aorta is the largest artery in the body. It carries oxygen-rich blood away from the heart to blood vessels that reach the rest of the body. The aorta starts at the top of the heart and goes down behind the heart. The other main organ in the chest is the lungs. The lungs fill our blood with oxygen. Carbon dioxide also leaves the body through the lungs. The esophagus is also in the chest. The esophagus is located behind the heart and windpipe, which is also known as the trachea. The esophagus is the tube that takes food from the mouth to the stomach. It is a part of the digestive tract. The chest also contains muscles, bones, and joints. Together, these form the chest wall. Ribs are thin, curved bones that create a cage around the organs in the chest. The ribs allow the lungs to expand and also protect the heart and lungs from being damaged. A tough, flexible tissue called cartilage connects the ribs to the breastbone or sternum. The sternum is a long, flat bone that forms the front center of the chest wall. The pleura is a membrane that lines the inside of the chest cavity. It also wraps around the outside of the lungs. Many problems can cause chest pain. There is no way to tell whether the pain is caused by your heart or something else without seeing your healthcare provider. The next 4 sections look at chest pain caused by heart, lung, digestive, and other problems. Heart-related chest pain. Chest pain may be caused by problems with the heart. Sometimes the pain is better described as discomfort rather than pain. Heart-related chest pain may also be described as severe chest pain or pressure. Crushing pain that may spread to the arms, neck, back, and jaw area. Pain that is prolonged, lasting anywhere from 30 minutes to several hours. If chest pain is caused by a heart attack, resting often does not help. Changing the position of the body does not relieve or change the pain either. Some people feel indigestion and nausea during a heart attack. This may be coupled with sweating, dizziness, or shortness of breath. Angina is pain in the chest and surrounding areas of the body. It happens when the heart does not get enough oxygen. It is very important to seek treatment for angina. If left untreated, it may result in a heart attack. A heart attack is an extreme, life-threatening case of angina. Angina usually happens when a person exerts a lot of physical effort for a few minutes. It usually goes away when the person rests or takes medication. Sometimes it can happen at rest also. An aortic dissection can also cause chest pain. It is a life-threatening condition. Aortic dissection happens when the walls of the aorta become thin, balloon, and then rupture. Pericarditis is an inflammation of the pericardium or the sac that surrounds the heart. It is often related to a viral infection and can cause chest pain. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Lung-related chest pain. Many different lung disorders can cause chest pain. If chest pain is caused by a lung problem, the pain often gets worse when you breathe deeply, cough, or sneeze. Lung problems that cause chest pain may also cause other symptoms, including chest tightness, extreme tiredness, fever and chills, irregular or rapid heartbeat, shortness of breath. Some people with lung diseases that can cause chest pain also experience feelings of anxiety or dread, lightheadedness or fainting, and sweating. One common cause of lung-related chest pain is pneumonia. Pneumonia is a common infection in one or both lungs. Many germs, such as bacteria, viruses, and fungi, can cause pneumonia. Pleurisy can also cause chest pain. Pleurisy is a condition in which the pleura is inflamed. The pleura is the membrane that lines the inside of the chest cavity. There are many causes of pleurisy, but often it is the result of a viral infection. A pulmonary embolism is a sudden blockage in a lung artery. The blockage is usually caused by a blood clot that travels to the lung from a vein in the leg. It can be life-threatening and often causes severe chest pain. If air leaks into the space between a lung and the ribs, it can cause the lung to collapse. A collapsed lung can cause chest pain that starts suddenly and lasts for several hours. Pulmonary hypertension may also cause chest pain. Pulmonary hypertension is high blood pressure in the arteries of the lung. Digestive-related chest pain. Chest pain may be caused by problems with the digestive system. In some cases, chest pain may be worse after eating if it is caused by a digestive problem. Most digestive problems that can cause chest pain also cause other symptoms. Some of these symptoms include burning in the chest, difficulty swallowing, nausea or vomiting, pain in the back between the shoulder blades, pain under the right shoulder, steady pain in the upper abdomen. A common digestive-related cause of chest pain is heartburn. Heartburn is a painful burning feeling in your chest and throat. It happens when stomach acid backs up into the esophagus. Almost everyone experiences heartburn at some point in their life. Swallowing disorders can also be a cause of chest pain. Problems with the esophagus can make swallowing difficult and painful. Problems with the gallbladder and pancreas can also cause chest pain, even though these organs are not in the chest. The gallbladder and pancreas are located in the upper abdomen. Inflammation of these organs can cause pain in the abdomen that sometimes spreads to the chest. Other causes of chest pain. Sometimes chest pain may be caused by problems with the muscles or bones in the chest. For example, sore muscles and injured ribs may cause chest pain. Costochondritis is a condition in which the cartilage in the rib cage becomes swollen and inflamed. It can also cause chest pain that may feel like a heart attack. People who experience panic attacks may also have chest pain. Panic attacks are sudden feelings of terror for no reason and can cause fast heartbeat, chest pain, breathing difficulty, dizziness. The symptoms of a panic attack are similar to the symptoms of a heart attack. It can be difficult to tell which is causing your symptoms. Seek emergency medical advice. Shingles is a disease caused by the same virus that causes chickenpox. The virus stays in your body after you have chickenpox and may reappear as shingles later in life. Shingles may cause a band of blisters on the back and chest, as well as chest pain. When to see a doctor. Seek emergency medical advice if you have chest pain or pressure that is new or different, lasts longer than 2 to 3 minutes, leaves and then returns. Always treat chest pain seriously. Even if the chest pain is not related to a heart attack, it is better to be safe and be checked by a healthcare provider. Other causes of chest pain may also need immediate treatment to prevent complications. Diagnosis. Your healthcare provider will ask about your medical history and symptoms. You will also be asked about the medications you are currently taking. A physical exam will also be done. With chest pain, healthcare providers first want to check the heart. An electrocardiogram or ECG records the electrical activity of the heart. It can show whether a heart attack is in progress or has already happened. Healthcare providers also want to check for life-threatening lung conditions. A chest X-ray can show the size and shape of the heart and lungs. It can also show lung problems, such as pneumonia or a collapsed lung. Other imaging tests may be done to look at the organs and structures in the chest more closely. These include a CT scan or MRI. Blood tests may be done. Depending on the results of the tests, your healthcare provider may order other tests to diagnose or rule out problems. After the cause of your chest pain has been diagnosed, your healthcare provider may recommend different treatments. Treatment for chest pain depends on the cause.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. When you experience pain in your chest, it can be scary. It does not always mean that you are having a heart attack. There can be many other causes of chest pain, such as lung or digestive problems. Even when it is not caused by a heart attack, chest pain can be a sign of a serious problem. You should seek emergency medical advice if you have chest pain or pressure that is new or different, lasts longer than 2 to 3 minutes, leaves and then returns.
Thank you for using Explain.